Okay, you guys have to know the different schedules of narcotics. This is probably, before you hit your drug cards, these are like chapters, I don't know, 1 through 4, 1 through 6. So Schedule 1, Schedule 2, Schedule 3, Schedule 4. You need to know a little bit about the different schedules. So I'll give you a medication and I'm going to simply say, what schedule is this? When reviewing a patient's home medication, what are some of the priority questions you'll ask? And it's not obviously about a medication per se, it's really about the list. What are some of the things you would ask when they tell you what meds they're on? What patients will have an alteration in drug metabolism? You're going to be given a list of patients and you have to pick out which one is going to have a problem with drug metabolism. So you got to look up what drug metabolism is and what patients are at risk. What is first pass effect? What's the difference between active and passive transport? A patient on multiple medications, what would be a nursing priority for a patient on multiple medications? What's that? What would be a priority nursing intervention if a patient's on multiple medications? What should you do? When teaching about a newly prescribed medication, what teaching point will improve adherence and safety? What makes patients adhere to taking medication? And again, it's not a specific drug. It's probably just as simple as making sure they know what the adverse effects are and mitigating adverse effects. If a medication causes, I could think about my mom taking antibiotics, it always made her have like a little bit of GI upset. So she would never want to take it because she thought there was something bad was happening. If somebody just, reassured her that it wasn't, it's a normal effect from the medication. You have to know what is a super infection. What would be a priority nursing diagnosis for somebody who's on a sedative?
Is a diagnosis, right?
Yeah, nursing diagnosis. Hold on, I'm trying to figure out this one. This one, what? Do this one or not? Hold on. I don't know if he wants me to get rid of this one. Hold on, let me look at this. So, I don't know if this is gonna get thrown out or not, I'm not sure, but I'm gonna tell it to you anyways. When taking a medication history on a client, which action by the nurse best reduces the possibility of adverse interactions? So when doing a med reconciliation on a patient, when you're taking their meds down, what best reduces the possibility of adverse interactions? Sort of a hard question to answer. It might get thrown out, people. When giving medications, the only child question that I need you to know, what's the most important?
Wait. Wait.
How'd you know that?
Because you said it last week.
Yeah, okay, I gave you the answer. Okay, wait, with children. The most important thing when you're giving drugs to children
Okay.
is knowing their weight, because a lot of meds are weight-based.
I thought she's meant weight.
Everybody got that one right. All right, we already got 2 points already.
Yeah.
Okay, we have a math problem here. Conversions between measurement systems. Better know your kilograms to pounds, milliliters to cups, teaspoons to tablespoons, grams to milligrams. Right? How many milliliters in a tablespoon? Review all that. Let me grab, let me mark this up too much.
On the recorded?
Oh, we do it right.
Huh? What is that? Oh, yeah, you did see it. Good work, appreciate you. Told her we're about to have buddies. I can't believe
Yeah. You wanna go?
Sorry about
Show it to Lady.
You didn't see that?
All right, a client is hypovolemic from vomiting and diarrhea. Blood is likely hypertonic as a result of all this fluid loss. What effect does the nurse expect will have on red blood cells?
I'm sorry. Blood is hypotonic?
Hyper.
Hypertonic.
Yep, hypertonic. Patient has lost a lot of volume. What will happen to those red blood cells? Sodium potassium pump. What type of transport system is it? A newly prescribed anti-infective medication produces therapeutic effect.
Bless you.
Excuse me, sorry.
Can you repeat that?
Yeah.
Hold on, I gotta,
Take that.
sorry. Sorry, guys.
It's all right.
What is the goal of anti-infectives? What is the goal of anti-infectives?
Same question, right?
Yeah, it's the same question. I worded it a little bit differently. What's the goal of anti-infectives? Know the difference between narrow spectrum, broad spectrum? Another thing about superinfection, what's a priority nursing action when a patient is diagnosed with a superinfection? As it relates to a young woman of childbearing age. A client is treated with an aminoglycoside. What should be a priority? Knowing an aminoglycoside, big gun antibiotic, what is a priority nursing intervention? What should you be monitoring for with an aminoglycoside? Influenza. Oh, by the way, get your flu shots,
Oh, I got it.
okay? Make sure you get your paperwork in, otherwise you don't go to clinical with me next semester if you don't have your flu shots in. All right, influenza. Viruses are more difficult to treat. Why?
Viruses difficult to treat, why?
Influenza is a virus. Why are they difficult to treat? Look up the definition for a virus. All right, HIV medication, non-nucleoside reverse transcriptase inhibitor, the NNRTI. It is an antiviral agent. What is a very common adverse effect? Common adverse effect. So not serious, okay, very common. Okay, a client treated with athlete's foot and states symptoms have not gone away. What type of medication should somebody who has athlete foot be on? Why is it difficult to treat a fungal infection?
Because they're eukaryotic cells.
I'm not looking for an answer.
Oh, I'm so sorry. Forgive me.
Yeah, why are fungal infections so difficult? A patient is been prescribed a systemic antifungal drug. What sign or symptom should be reported immediately? So what would be a severe sign or symptom of a systemic antifungal? What is Giardias? Giardias.
Can you spell that one more time?
Yep, Giardias. What is it? How common is it in the United States? How common is it in the United States? The mother of a 6-month-old is diagnosed with a protozoal infection. What is a priority nursing assessment?
Diagnosed with what?
Protozoal. Okay, the drug albendazole. Albendazole. What assessment should be prioritized? What is a priority nursing assessment with albendazole? You have a patient with cancer, is getting radiation and chemotherapy with a combination of chemotherapeutics. What patient teaching is a priority with these drugs? And this is a select all that apply. What is the body's first line of defense? What is the body's first line of defense? All right, we have a patient who's on a non-steroidal anti-inflammatory drug. What would be an interaction? What other drug interacts with a non-steroidal? Yeah, we got another kid question here. We have a 6-year-old in the clinic, high fever. We want to know what type of medication will be prescribed, or which med will be anticipated. A patient with leukemia of childbearing age has been prescribed an immune modulator. What teaching needs to be done? You need to know the difference between passive immunity, active immunity, and serum sickness. What would be a normal response to a child receiving their first immunization? Normal response for their first immunization. What happens with depolarization? How long does it take for PO meds to take effect? What is alprazolam? Alprazolam? How long does it take to work? PO, sorry. Depression, this is a select all that apply. You already had this today. What neurotransmitters are involved?
Yeah.
Thank you.
Star.
Look up baclofen, what's it used for? What would be, a geriatric client is receiving a narcotic analgesic. What safety measures should you institute?
Is that geriatric?
Geriatric receiving a narcotic. What safety measures to institute?
Handrails up.
Morphine via PCA, patient controlled analgesia. What assessment should the nurse monitor for? Next one, select all that apply. Just remember, your select all that apply is more than one, and we don't pick all of them, right? That helps out a little bit. Alright. So we have a patient who is getting morphine. This is a difficult question to help you with. What action should the nurse perform? So take it back to the skills lab when you've given medication. Think about some of the things that routinely you do before you give medication. Specifically, morphine. So think about the drug morphine. What are some of the assessments you need to do? Why you need to do them? If there's an antidote, just saying, if there's an antidote to this drug, make sure you have it available. That drug, midazolam or Versed, what type of drug is it? Why is it useful given preoperatively? Midazolam, why is it useful given preoperatively? Okay, we have a perioperative patient. Why is there a safety risk for perioperative clients? What do these drugs generally do? What transmitter is related to neuromuscular diseases? What's the problem with succinylcholine and timolol eye drops? What's the problem with succinylcholine and timolol eye drops? You need to know the difference, sympathetic response, parasympathetic response. Um, when somebody takes their nails and runs them across a blackboard, you don't like that, huh? What effect will it have on you? There's a name for that. Right? What's it do to you? It gives you like goosebumps, right? Look up goosebumps. What is nicotinic receptors? What does it work on? What do the nicotinic receptors work on?
The 10 rights are 10 points?
No, no, they're not 10 points.
They're 1 point?
What are you looking at me like that for? No, it's just a benchmark. They have to know that you know them.
Fail.
10 points.
Retake.
All right, we have cardiogenic shock. Isopaternal is given IV. What's it going to do? Isopaternal for cardiogenic shock. Sympathomimetic. What type of drug is a sympathomimetic? What effect would you expect a sympathomimetic to have? You have another person in the ER, 80-year-old in shock. Dopamine is given. Why is dopamine given? And what would be a priority assessment? What can dopamine cause?
80-year-old in shock.
Yeah. What can dopamine cause? Now, if you just say it increases the blood pressure, you'd be right, it does. But there's something else that dopamine causes. We give it to increase the blood pressure. That's what we want. But it also causes something that's probably not a good effect. So know what that is. Adrenergic blocking agent, what is it? What's the mode of action? Adrenergic blocking agent. What would be a priority nursing assessment when giving an adrenergic blocking agent?
Is that a separate question?
Yeah, it is actually. Bethanechol, Bethanechol. What type of drug is this? Who are we giving it to? What's it used for? Bethanechol, Bethanechol. All right, take a 10-minute break. Come on back. And when you're on a break, whoever I said to come see me, maybe come see me.
So Propanol, what is it used for?
What type, and then put it together.
What type of drug it is?
I need these back, so if you just wanna take a quick seat, I wrote on these. This is like, it's probably on the back. It might simply be what your grade point average is now. Where's Ryan? Come here, Ryan.
My blood sugar. I'm like,